So after having listening to UK, Latvia, and Niger, now it's my great pleasure to introduce Dr. Mark Ryan, who is the Executive Director of the Emergency Program at WHO. Mike, you have the floor.
Thank you, Sylvie, and thank you to everyone here at WHO and all the partners who've been doing such amazing work in this space for now it seems like forever, but the last year, and it is of note as we come to the end of the first calendar year of our awareness of this, to see how our global landscape, how science and how ordinary lives have been changed and affected, sometimes positively, but very often for those people who are victims of this disease and its consequences. Some terrible outcomes and some terrible tragedies that we've witnessed. I am, though, I'm really, really impressed with the work of the six society tracks in the course of the last 6 weeks. I was trying to think of new names. Sylvie and Tim and Mindy and others are great at coming up with new names, infodemics. But this is, I was wondering, was this a discussathon or was it a talkathon or is it a consultathon over the last 6 weeks? But you must all be exhausted. But what I do sense in this is a massive, massive energy. 200 organizations, hundreds of panelists, more than 5,000 people attending these dialogues. This, in some sense, underpins and just clearly demonstrates the energy, the enthusiasm, the desire, but also the sense of purpose and sense of concern in this space. We, collectively, as a society, will get the management of information during epidemics right, and we will get it wrong. If we get it right, people will make good decisions, and those decisions may save their lives or somebody else's life. If we get it wrong, they will make bad decisions, and people will suffer because of that. So this is as important as PPE. This is as important as therapeutics. This is as important as a shot in the arm, because it gives people the tools to be able to manage the new world as we see it and as we face it. And the new world has both massive opportunities when it comes to information and the fourth industrial revolution and the Internet of Things, but it also is a daunting and sometimes scary place to be as infodemics wash over us and we don't know which pieces of information to pull from that tsunami and that forceful tsunami that sweeps us off our feet at times. This has been a truly whole of society engagement. And, you know, in a sense, what we've heard, I think, over the last 3 weeks, that we're all part of the problem and we're all part of the solution. It's not that we are the solution to somebody else's problem. We're all contributing information into this space, one level or another, and we have responsibilities in how we do that. And then we have responsibilities on how we give people tools to use that information and how we align the information between entities and organizations and deliver that in a collective, more cohesive, more integrated fashion as best we can. And as I said, we have these solutions at hand. I think the previous work that's been done in the previous 2 infodemics meetings as well, and the roadmap for research, and a lot of the issues have been laid out. And I think a lot of the talking has been done, and some of the solutions are emerging. And this process is already generating real, meaningful solutions. But, you know, we have to walk the talk now, and we have to start converting our commitment into practices and into outcomes that are meaningful for people, for their lives. We must commit to do our part. WHO is committing to do its part, but we are just part of that solution. I've said it since the first days of Gorn. No one institution has all the capacity to fight epidemics. That will remain. That was true 20 years ago. That was true 10 years ago, and it is even more true today. The collaboration needed across the public, the private, the non-governmental, the community, civil society, to work on this is massive. But as I said, we must commit, and we as WHO do commit to do our part. And that's why we are here partly today, and hopefully today, to issue a call that actually says that we need a global movement, something that moves us forward to promote access to health information and to mitigate harm from health misinformation, and both among online and offline communities. And as such, that is a manifesto. It's not a political manifesto. It is a call to action. It is a manifesto for the political commitment we need, the organizational commitment we need, the societal commitment we need to solve this problem. I'm going to hand over to Tim Nguyen, who's one of the midwives to this process, to maybe read to you the core of the manifesto. Thank you, Tim.
Thank you, Mike, for your kind introduction. We had our rapporteur listening in to the discussions over the last 6 weeks and try to distill the very good points all the tracks and society made, and we distilled this into a call of action. I will later explain a little bit how we're going to propose it to you. What I'm going to do now is to read out a summary text of what we heard from this discussion. We'll start with an introduction and then come to the concrete 7 actions we are asking all of us to commit to. Since the beginning of the outbreak over a year ago, the COVID-19 pandemic has gravely affected our societies and economies. Likewise, it has deeply disrupted the lives of billions of people across the globe, including the way we consume, produce, and react to information. Thanks to new technologies, we have been able to widely disseminate knowledge and evidence on this new disease. However, social media platforms have also been the carriers of falsehood and distortions. Underlining that the world is facing a rapid amplification and circulation of accurate but also false information, the UN Secretary General and the Director General of the World Health Organization both declared that we are currently fighting an infodemic in the same way we are fighting a pandemic. An infodemic is defined as a tsunami of information, some accurate, some not, that spreads alongside an epidemic. If it's not managed accordingly, an infodemic can have direct negative impacts on the health and populations and the public health response by undermining the trust in science and interventions. We are also seeing that infodemics hinder the cohesiveness of societies by increasing existing inequities, stigma, gender disparity, and generation rift. Although infodemics are not a new phenomenon, the volume and the rapid scale-up of facts, but also misinformation and disinformation surrounding the COVID-19 outbreak are unprecedented. Owing to the opportunities and challenges brought by new technologies and social media platforms, the infodemic that accompanies the first pandemic of the digital age is more visible and challenging than ever before. Practicing information hygiene, just as we are practicing hand and cough hygiene, is thus becoming vital to prevent the spread of the virus. This overflow of information knows no boundaries and affects our physical as well as our digital spaces. By acting together to improve infodemic management online and offline and advocating for continued solidarity, we believe that we can help our communities and those most vulnerable adopt healthy behaviors. As outlined in the resolution on COVID-19 adopted by the consensus at the 73rd World Health Assembly and the G20 Health Ministers Declaration of the Riot Summit, we need to provide populations with reliable and comprehensive information on COVID-19 and take measures to counter misinformation and disinformation. The response to this infodemic demands the support, development, and application of efficient solutions that equip individuals and their communities with the knowledge and tools to promote accurate health information and mitigate the harm that misinformation and disinformation causes. Fully aware of the limits of top-down approaches, we call upon the implementation of interventions that engage with, listen to, inform, and empower people so they can make decisions to protect themselves and others. Deeply concerned with the undermining consequences of the current infodemic due to COVID-19 response, and acknowledging the great potential for improved risk communication through new tools, we hereby call on key stakeholders and the global community to commit to undertaking the following actions. First, Recognize that an infodemic is a tsunami of information, some accurate, some not, that spreads alongside an epidemic, and note that it cannot be eliminated, but it can be managed. Second, acknowledge that infodemic management can reduce the direct and indirect negative impacts on the health of populations, as well as growing mistrust towards governments, science, and health personnel, which has fueled the polarization of societies. Third, emphasize that everyone has a role to play in addressing the infodemic. Fourth, support a whole of society approach and engage with communities in the production, verification, and dissemination of information that leads to healthy behaviors during epidemics and pandemics. Fifth, commit to finding solutions and tools consistent with the freedom of expression to manage the infodemic, embedding the use of digital technologies and data science. Six, strive to make science more accessible, transparent, and understandable, maintain trusted sources of information, and promote evidence-informed policies, thereby fostering people's trust in them. Seventh, learn from the COVID-19 infodemic management practices and share experience on value-added partnerships. We encourage other organizations and individuals to join us and the World Health Organization in making these commitments and holding ourselves accountable to them by signing this statement of commitment. What we would like to invite you is we will share a link to our website, posting again this call for action. And we have a registration form for you to sign if you're in agreement and join us in this call for action. We will launch it today and have it open until the 14th of February. So we can then formally see how many of you joined us by the 15th of February. We picked this date because the 15th of February marks the anniversary, the 1-year anniversary, when the WHO Director General, Dr. Tedros, declared that we are also fighting an infodemic alongside this epidemic. So we hope that in the next 2 months, we can collect and rattle you against this call for action. Thank you very much. Back to Silly or Mike.
Thanks, Tim. That's fantastic. And yeah, if we could all live up to the commitments in that manifesto, we would make huge progress together. It's wonderful to see this movement and manifesto or not, the fact so many have come together to share ideas and come up with common solutions. That's, for me, half the battle, more than half the battle. But coming together and formally recognizing a statement also allows us to leverage the kind of political support and the investment that we're going to need to make this science truly effective and to drive this process forward, especially in empowering people all over the world, not just in countries with resources, but be able to drive this process throughout the world and participation by all, innovation by all. And I think one thing that's great about information management and great about communications and community engagement, this is the one area I think where the world is the flattest, and I don't mean flat earth, but where the differentials in knowledge and contribution are actually remarkably sometimes in the other direction than what people expect. I have learned more about effective communication, about community engagement, and about trust from my colleagues in Africa and the Middle East and the Far East. And in fact, in this particular pandemic, the developing world has offered solutions south to north, especially in this area. And maybe the north should have been listening a little bit more intently, as under-resourced health systems in the south contained epidemics by leveraging community engagement, by leveraging knowledge, and by leveraging the management of good information. So for that, we thank those who have led the way in all parts of the world. And again, it's wonderful to see this taking shape. And Tedros, as you know, often says science, solidarity, and solutions. So with infodemiology, thank you, Sylvie, and all, we're getting the science. With your engagement, we have the solidarity. With this manifesto and with your broad engagement in the future, together, we will find and deliver the solutions. Thank you.
Thank you very much, Mike and Tim, for those words. And just to highlight that Mike said that there was a lot of energy here in this room and in this team and online. But I have to thank him also for his energy. Because he has been giving so much to the communication since the beginning of this pandemic with many pressers every week. And his energy has been also so inspiring for all of us. So just to tell you that here we are very committed to this cause of managing better infodemic. Because we see the risk, but also we see the fantastic opportunities that we have to work together and make it happen.